soda. Other offending agents, but this is all about moderation and something I call body intelligence, are caffeine and alcohol. Alcohol always in moderation, and caffeine studies have shown drinking and consuming less than 400 milligrams a day is okay for most people. Caffeine on its own is actually an okay substance. I think there are two issues with caffeine. One, what we add to our coffee, like my client Bill, these 8 teaspoons of sugar. And the other with coffee is having too much of it and not realizing that we cannot tolerate more than a certain amount. And if it makes you jittery and uncomfortable, then it's not for you. So those are some of the ones to really, really keep an eye out for, as well as in some studies, consuming gluten was associated with more anxiety. So it's not something I ask people to exclude unless they have. We're not able to correct some of their symptoms through other dietary changes. And I usually help them find more wholesome sources of gluten than, say, processed sliced bread from the supermarket that, is very shelf stable and has a lot of preservatives in them.
Well, just to be clear on your caffeine consumption you talk about in the book, and I like the way you break it down. I just want our audience to be, very clear on this. So a venti from Starbucks is over the limit. It's like 470 milligrams of caffeine. So one of those, like, you're already over the limit, right? And you say, like, in the book, like, no caffeine past 3 o'clock because of how it affects our sleep. I think that's right. Yeah. And also, so that would be maybe 4 cups of coffee before 3 o'clock is the max. So just so people are clear, about the caffeine consumption that's out there.
Right. And here's the thing, because of the uniqueness of the gut microbiome, it's like kind of like a thumbprint for every one of us. People are different. Some people drink a ton of coffee and they're fine. But some people have half a cup and their heart is racing, they're feeling jittery. So it really is paying attention to that body temperature. I like the guideline that you gave because caffeine definitely impacts your sleep. Some people actually don't drink a cup of coffee past 1 o'clock. I'm one of those people because I find I love coffee, but if I'm having it late in the day, I can be up at night. So it's something I learned from my own body and realized that it's something I need to do differently. Some people can tolerate more and it doesn't affect their sleep, but this is a guidance that, if you're getting those large cups of coffee, firstly, be careful what you're putting in them. And secondly, realize how much of caffeine you're consuming.
And actually, let's clear alcohol up as well. I think you mentioned alcohol so much in the book about it's part of, which I was interesting, is part of the Mediterranean eating pattern, like 2 glasses of wine max. You say that for moderate drinking, I want to get really clear what moderate drinking is. You say it's like no more than 14 drinks a week for men, 7 for women, tops or less. And then it's 2 beers, a beer is like 7 to 12, 10% alcohol. Wine is like 14. And then if I'm drinking bourbon, it's like 40%. So it's 40, I don't want to be doing pounding 14 bourbons a week. Do I? Is that different?
No, I think that's a really great question. And one that I actually want to clarify because, the guidelines, the book was written a few years, when you publish a book, it's written about the year before. And I would say that a lot of updated guidances are probably much more conservative. And also, I feel that, so I like the fact that you're asking that question, because here's the thing with alcohol. It may not be for you. The pandemic has shown us that drug and alcohol use has risen tremendously. The confinement and quarantine of the pandemic, the loneliness, isolation, and other problems have really escalated substance abuse. So I want to be especially mindful about this. So I love the fact that you asked that question. And here's my answer to your guidance around it. If you're not someone who drinks a lot of wine or alcohol, continue as you are doing. No one says because it's in the so-called diet, you have to now consume the wine. Just continue on your path because that's good for you. Alcohol in moderation is great. And I think the guidances are much lower than I had originally stated because the guidances have changed. So I would say, a red wine with resveratrol, which is a antioxidant, good idea. Once you have to have 2 glasses every night? No. Do some people do that? Yes, and maybe they're perfectly fine. The other thing is helping our community and helping one another. If you're noticing a friend who perhaps a struggle during the pandemic and is consuming a little bit more. Um, like that patient who began traveling so much and was under pressure in her networking meetings, then realize that you can offer help, you can guide people towards resources for this type of thing because it's a big issue right now.
And how does alcohol contribute to anxiety? I know you mentioned, if some people will, drink alcohol at night so they go to sleep, which they don't get into the deeper sleep and also the REM patterns. But then the next
Right.
morning, you mentioned like they could be have anxiety because I don't know if their body's going through withdrawal or what. But like, how does that affect? Like, okay, so I slept off my alcohol, probably didn't sleep as deep as I wanted to because of the alcohol, and then the next day I'm like, oh, I'm already stressed and I just woke up.
Correct. So there's a couple of mechanisms. So one mechanism is if you're leaning on that glass of wine or maybe a drink or two to put you to sleep, it's ultimately going to completely disrupt your sleep architecture, which is what you're referring to. And that's not what you want to be. We should not be using alcohol as a crutch to get us to sleep. You should be speaking to your doctor about problems with sleep. But the problem with how much you drink and what you're able to tolerate is people wake up with anxiety, which is that feeling of angst. Maybe they've had a few many drinks the night before, their heart is racing. In clinical terms, it's sort of mild withdrawal from alcohol, right? You've drank a whole lot the day before, and your body is responding because it's not getting alcohol at 7 a.m. So that type of you get what we call hang anxiety, or it's just anxiety from waking up, having underlying anxiety, that being now precipitated. A couple of things with that, you could be mildly dehydrated if you're not drinking a ton of water as you're consuming whichever form of alcohol. You could be dehydrated, which would lead to anxiety as well. So there's different mechanisms to be careful of. And that's why, I go back to drinking moderation, not every day, just because a guidance says that or prior guidance or current, do what makes you feel best. And that's, again, body intelligence, be led by that.